Hey guys, welcome back to Cerebral Stick Up. We've got a great show for you today. A very special guest. Her name is Seeman. Jaime is an OBGYN doctor, a fitness athlete, and also best well known for her attendance in the athletic competition held by NBC with Dwayne "The Rock" Johnson called the Titans Games. So please welcome to the show, Jaime Seeman.
Hi.
How you doing?
Good.
Finally got it working.
The technology gods.
So how's everything going with the virus and everything? I know that you're kind of on the front lines with being in medicine.
Yeah, it's actually in Nebraska we're doing pretty well.
Hmm.
So we're seeing, small pockets of uptick, but really all in all doing quite well and starting to reopen a lot of things, and school's planning to start in a month. And so
Hmm.
I don't know, I'm an optimistic person. I think things are
Okay.
going quite well in my state, but
Yeah, yeah. So, and we can kind of like get into it if for a little bit, since you're in the medical field. Like, what do you think about the virus? Like, do you think it's overblown? Do you think it's like legitimate as far as the precautions and everything like that?
yeah, I mean, COVID-19 is legitimate. It's a novel virus that we've never seen, which makes it very difficult for people to speculate and predict, and nobody has a crystal ball. I do think the media tends to dramatize things that get a lot of clicks, but it's real. And the fact of the matter is, it's not going anywhere. This is just like any other virus that is in our world, influenza, herpes virus, shingles, varicella. We have to figure out how to live with this virus. We can't hide from it. And the lockdown and shutdown was never meant to prevent us from getting exposed. It was to drag out the exposures to not overwhelm our healthcare system.
Hmm.
So at some point, we have to figure out how to reopen.
Do you think like the end goal is to have a vaccine, or do you think we just have to live with the new norm?
I think the vaccine sounds like a great idea. The problem is the type of virus that SARS-CoV-2 is. We've never been able to create a vaccine with this type of RNA technology. And so we just don't know how effective it will be. The other issue is the first trial that came out, even people that have had SARS-CoV-2, we have people that are not showing immunity months down the road. So there's a
Mhm.
real question as to if people will actually carry that immunity, or if a vaccine were to come out, if it will require multiple boosters to be effective. And those are just complete unknowns.
And they're not even, as far as I know, it's like they're not even really, close to even, making even progressing like to a point where they can even do like real trials, right? On something that's like worthwhile.
Right. So the first human trial from one company has been done, but it's very early. It's, as
Mhm.
practitioners, there's really no way for us to guide anybody because we just don't know. We're sitting with everyone else, watching, waiting.
Right. So you are OBGYN, right, doctor? Correct?
Yes, board certified OBGYN.
Okay. And so what is that like? What does that entail? I mean, most people kind of know like what OBGYN does like in a general scope, but do you work like with pregnancies? Do you do any of that work?
So I think most people, if you ask what we do, they just think we deliver babies, but
Hmm.
we take care of women from their teenage years all the way through basically the end of life, doing well woman's care, primary care. But we're also surgeons. So we do hysterectomies, we operate on the pelvic floor, incontinence procedures, obviously C-sections. So it's really a broad spectrum of women's health practice.
Hmm. So like a surgeon as opposed to just in clinic type of doctor, do you what do you see more of? Do you do mostly like in clinic, or do you do a lot of surgeries as well?
Yeah, so I went into this specialty because I like procedures. I like being a surgeon. So basically, I'm in clinic 4 days a week seeing patients. I mean, to do surgery, you have to see patients, you have to work them up, you have to,
Mhm.
obviously, these surgeries have to be indicated. They don't
Yeah.
just magically fall into your OR, but I operate basically any day of the week that a patient needs a procedure.
Okay. So you're pretty busy, I would say.
Yes, yes, I'm a full-time OBGYN.
So how do you find time to, be, into fitness and training? Because I mean, you've got obviously a solid build. The reason that I'm speaking with you is because most people now know you from the show, Dwayne Johnson's the Titan Games. So like, how do you find that time while being, a surgeon, in dealing with that?
So my story is that I grew up as an athlete. I was a 3-sport athlete. I played college softball, but when I left competing back in 2007 is when I was done competing. I went to medical school and I thought, the athletic world was done. And all of a sudden here was like a huge change of pace in my life. I kind of just became what I would call like a weekend warrior. When I had time. Medical school is very time consuming. And then I had 3 children. So I really didn't get back into taking care of myself until about 5 years ago. And it really started more of as a nutrition dietary approach. Like, oh my gosh, I have to start eating better. I found out I had pre-diabetes and hypothyroidism. I felt like a huge imposter because I have a background in nutrition and exercise science. But I always say I'm just as human as my patients. I have all the same problems that everybody else has, all the women that sit across from me in the clinic rooms. So I got back into the gym 2 years ago, which is, I think, pretty incredible when you look at where I, came to be on Titan Games. But I say pay yourself first. So my daily routine, I wake up at 4:30 every day and I hit the gym at 5 a.m. because it's the least likely time that someone's going to interrupt my workout. And I feel like you have to take care of yourself first before you can take care of other people. I say quit trying to fill everyone else's cup if your pitcher's empty. So it may seem really selfish to some people, but I put myself first. My workout is the most important thing of the day. And then I control what I eat throughout the day, right? We have to eat, but you can make good choices. And that's how I'm able to live the life and the pace that I live.
So you said that about 5 years ago, you found out about the prediabetes and thyroid issues. What led you to start thinking that direction? Did you experience some symptoms? Like, how did you go, about that?
Yeah. So I have a, long-standing family history of diabetes in my family. But when I got pregnant with my first daughter while I was in medical school, I failed my glucose testing and ended up failing it in every pregnancy. I was not eating great. I was everything your doctor would tell you not to be. But it was hard. I was working 80 hours a week. I mean, at one point I had a newborn 2-year-old and 4-year-old. You just get into that kind of rut of life. And I started to really just make up excuses and blame, shame, justify, the things I was eating and the fact that I didn't have time to work out. But the, truth is we all have the same 24 hours. We just choose how to use it. And 5 years ago, I lost my best friend in the middle of her pregnancy. And it was around that time that I found out I had pre-diabetes and hypothyroidism. And it was just this really critical juncture in my life when I decided that I was going to live my life with a different purpose and a different passion. And it was really from losing my best friend. I was like, okay, I could be dead tomorrow. I mean, she was 29 years old. She had no health problems. Her life was taken by a super rare fungal infection in her lungs. And I just decided that every single day that I woke up out of my bed and that I was breathing, I was grateful to be alive and that I wasn't going to waste that opportunity to do something great in the world. And that's when I started taking care of myself. But what started as just trying to eat right and move right really manifested in every single area of my life. My job got better. I became a better mom, a better wife. I started a consulting business. I ended up becoming a board certified ketogenic nutrition specialist to try to help every other woman that was out there in my exact position. Because the American healthcare system is not helping anybody. We're really good at putting band-aids on things and keeping people alive for a long time, but with chronic morbid conditions. So now the way that I practice medicine is preventative. So I'm finishing my integrative medicine fellowship. I'll be dual board certified in integrative medicine and as an OBGYN, which is very unique for my field. You really don't even see people with a background in nutrition to begin with, let alone integrative and functional. It's a very kind of niche marketplace, but my patients love it because we talk about things that other doctors don't talk about and don't have time to talk about or don't have the expertise to talk about.
So why do you think, and that's a kind of like an interesting subject for me, as well, because when I go to like doctors, like I assess them, especially the first few times. If I've, go to a new doctor, I assess on how they're thinking, and you can tell by the way they speak, like if they're kind of like old school and they don't really want to. They're not progressive, I guess, is the best way to put it. They kind of think in old ways and old patterns. And do you feel like there's like a reason for that? That you said the American medical system is kind of like putting band-aids on. Do you think there's is it the schooling? Is it just kind of like the beast itself? Like what do you think about that?
So traditional medicine is basically when a patient comes to you and says, I have these problems, right? They present with some sort of symptoms. And as a physician, it's your job to identify those patterns, do an examination, right? You're like a detective trying to
Mhm.
figure out what it is. And it's your job to give it a diagnosis and then give it a treatment. But the treatment options that we learn as physicians in Western medicine, it's usually it's medicine. It's surgery, it's medicine, it's some sort of intervention. And what we don't talk about, we learn it, right? We're taught in medical school if they have diabetes that they should change their diet, they should change how they move, right? We're taught about lifestyle interventions. But as a physician, we don't have the tools to tell people how to make those changes. And it's really a collaborative effort, right? They've tried to create this healthcare model where maybe a doctor has a nutritionist in their office or a trainer or, or whatever it is, but nobody has ever actually done it before. And so integrative and functional medicine is basically identifying preventable conditions and trying to reverse them or cure them or prevent them before they happen, which I think is the solution to fixing healthcare in America. But the unfortunate truth for anybody that's listening is that nobody should care more about your health than you. So it's time for each and every one of us as an individual to start taking accountability for our own health before we start complaining about how much healthcare costs or how the healthcare system is structured, because we each have the ability every single day to make decisions that impact our risk long term.
So do you think the major issue that in America people face is their diet? Is that, or would you think it's something else?
Diet is really almost 100% of it. So everything in our world is paid for by food companies. They have a lot of money. They have a lot of influence. They create foods that are hyper palatable. So ultra processed foods, full of vegetable oils, flour, and sugar, which are basically the three things that cause chronic diseases in our country and really around the world.
Mhm.
They taste good. It's addicting and they're very convenient, right? We live a very fast paced, stress paced world, got to eat on the go, got to do things that are quick and easy. So food is huge, and really it's the availability. And then part of it too is that some of what we have learned in healthcare is probably wrong. So since the 1970s, we've been vilifying fat in the diet, when really we should have been going after flour, sugar, and vegetable oils. And we're really starting to see the tables turn now. But people are going to have to speak with their dollar, because if we continue to patronize these big food companies, they're not going to make any changes. They're going to give people what they want.
So are you a proponent then of just like whole foods? Like is that what you would recommend?
Yeah, I mean, you can put a name on it, right? You could be keto or paleo or ancestral, or, there's lots of different ways to do it.
Hmm.
But a whole food diet is super important. The one thing though, that I'm a believer in is we have in medicine, even kind of this big movement in plant-based diets.
Hmm.
And what I found personally and professionally in my clinic is that when we vilified fat in the diet, we also scared people from eating red meat.
Hmm.
And animal foods, ruminant animals like cows that eat their natural diet, like grass-fed beef, have the best, most bioavailable nutrient profile compared to any plant source out there. And as a woman and as somebody who cares about being strong, because muscle is the organ of longevity, we're eating less meat now than we were 30 years ago. And the lack of protein in the diet is another reason why we see a lot of chronic disease. And so from my whole food approach, I'm a huge advocate for animal-based diets.
Hmm.
If your gut can tolerate plants, that's okay too. But I find a lot of chronic conditions like autoimmune conditions that are actually best treated with almost a carnivore diet-like approach.
That's so interesting because I would imagine, and there's probably people like you out there, but what we tend to hear is the opposite, right? Like we tend to always hear like the plant-based stuff. Oh, red meat is terrible for you. It causes all these problems. Plants are, a miracle. And, I lean towards your way of thinking. I do feel like, plants are important. You have to eat because you do get like some fibers and this and that and the other. But meat there's so many like amino acids and things that you just can't get from, from just eating plants, or you would have to eat so much of the plants that no one eats that much, of plant-based foods. So I think that this would be like very unique for people to hear, especially that you're so credentialed, and a lot of times when we hear people speaking this way, they're more like fitness nutritionists and just nobody really that's medically certified. And I think that's really important. Going along with that, how important do you think it is that fact that you are, who you are, you train, you eat right, when people look at you, obviously you've got a strong build. So how important is that to your patients? Like, do you feel like that they are more confident in you because of you basically do it yourself?
Yeah. So when I started this 5 years ago, it was very personal for me. I felt like as a healthcare provider, I felt like an imposter. I had these reversible medical conditions. How dare I sit in a clinic room every single day and tell people to eat healthy and move their body and get a lot of sleep and don't be stressed when I couldn't even do it myself.
Mm-hmm.
And so I think as healthcare providers, we need to walk the walk instead of talking the talk. Like I would never hire a personal trainer that was super out of shape, right? And so that's going to be an unpopular statement because if you look at most healthcare providers, they don't take care of themselves. They don't sleep. They're on tons of caffeine. Maybe they smoke. They're overweight. I just feel like to advocate for preventative healthcare, I have to be a walking billboard. I have to show people that I can be a mom of 3. I can be a doctor that works full time, and I can still take care of myself.
Yeah. Definitely you wear a lot of hats. I mean, it's commendable. And I'm sure that when people see this podcast and then other things that you've been on, they're definitely going to look into, your way of thinking more. So we can talk about medicine for a long time, but let's talk about the show, the Dwayne Johnson's A Titan Games show. How did you get on that? Were you interested yourself? Did they contact you? How did that work?
So about, I don't know, a year and a half ago when season 1 came out, I was in the operating room doing surgery and a scrub tech said, "Dr. Seeman, I think you should try out for the Titan Games." And I kind of looked at her and I'm like, "What are you talking about?" I had to go home and literally Google it. And I pull it up and I'm watching one of the episodes from season 1, and it really reminded me of American Gladiators when I was a young girl. And I thought, this looks really cool. So I click on the website and I'm looking at what you have to do to apply. And you have to make this video in real time doing pull-ups and push-ups and unlimited amounts of planks and all this stuff. And like I reminded you earlier, I had only been back in the gym for 2 years. And so at this time, when I'm actually looking at the application, I'd only been lifting weights again for a year. And I looked at these people and said, there is no way that I can do that. We all have very, self-limiting beliefs and doubts, and we're always our own biggest critic. And so I just kind of put it to the side. But at the time, I had started following them on social media. And so fast forward a couple months, here's The Rock, Dwayne, The Rock Johnson saying, I need real everyday heroes to apply for season 2. And it just kind of was eating away at my brain. And so I pull up the application again, and how the energy of the world works. Somebody from their casting had actually reached out and said, I think you'd be an amazing applicant. You should apply. So I applied, I sent in my video, and found out a few months later I was selected to go out to the combine, which is like a physical tryout. Basically, they bring in a bunch of people, they put you through a bunch of physical testing. And just being at the combine was very humbling. I mean, you look around, I was one of the oldest women there. I think there was only one woman that was older than me, maybe two. And, you know, these people that are like top 10 CrossFitters in the world. And you're like, why am I here? But once again, those self-limiting beliefs are always there. And found out a couple days after the combine that I was selected to be on the show, one of 18 women and 18 men. And I couldn't be more honored. And it was a yes with a capital Y when I
Yeah,
got that phone call.
that must have been very exciting news. So did you continue training? Like, how does that work? So I mean, you have like certain times that you guys were recording. In between those times, are you training for for these events? How does that work?
Well, knowing that I had applied for the show, you know, I was really trying to do a lot of heavy resistance training. All I knew from season one was I'm probably going to have to pull heavy stuff, push heavy stuff, and still be fast. So I was training as best as I could, but the timeline of events from finding out you're going to the combine going to filming was literally like a week turnaround. So we didn't really have the time to train like people may have imagined. And then once you found out you're on the show, all I was thinking was, oh my God, don't get injured and not be able to go compete. So you don't want to like all of a sudden be trying, you know, new things. And for anybody that has seen the show, these obstacles that Dwayne's people come up with are not everyday things. I mean, I was like climbing chain link fences, hanging from the ceiling, we're swinging from ropes. I don't think that anybody would have been able to train in any specific way. I mean, you have to be strong and you have to be fast, and they're really looking for the most well-rounded athlete.
Mm-hmm. Yeah, athleticism seems like it's super important. Like just being able to be, in a lot of cases, I mean, like you said, strong and fast, but also agility. I felt like agility was really important in some of those competitions. Would you agree?
Yeah, and I think it depends, you know, what you got, because we
Hmm.
basically showed up and they're like, this is what you're doing, and we didn't get to touch or try them out. When
I
you
see.
see me on chain link, when they say 3 2 1 go, that's the first time I've ever touched that obstacle. But I think it kind of depended, luck of the draw, you know, what you got, because some of them were more of a foot race and some of them were more of a battle, you know, against the other
Hmm.
person. And certainly everybody has their advantages, you know, whether you're stronger or faster, if that was going to help you or hurt you.
Right. Yeah. No, that makes sense. So like right now, in particular, I'm thinking of the event, and you have to excuse me because I don't know everyone's name or can't remember it, I should say. But Clarissa Shields was there. Another young lady was, I believe, a track star was
Yeah,
there.
Shantae McMillan.
Yeah, Shantae and you. And in that event, like, how did you feel about that event as you were going through it? Like, what was going through your mind?
Yeah, so you're talking about hammer down, where it was
Right.
a sledgehammer and you had to knock down the poles and climb up them. So we didn't get to watch anybody else compete. So, but we had heard, I was, you know, later in the day, and I had heard people were falling off. Like I said, we never got to climb on the poles. So all I could imagine, it's like this painted steel pole and
Hmm.
it's like really slippery. So I wasn't looking, you know, to see what was happening during the event, but I knew that Clarissa and I were kind of getting on at the same time. And all I told myself was, just don't fall off, just don't fall off. And I remember catching out of the corner of my eye when she slipped.
Hmm.
And then at that point, I was like, if you don't fall off, you have this. And I think it was just, you know, persistence and slow and steady won the race there.
Yeah, yeah. No, there was a point where it looked like you fell behind a little bit. You were the third one, but then quickly you were able to hammer like the rest of the poles down. And I was speaking with Caleb Redden not that long ago, and he had a very unique way of climbing up the pole. Like he had his hands positioned a particular way, and that was really like effective, I thought. And when I saw Clarissa like hanging, I could tell, oh, she's exhausted. Like it's going to be so difficult to go underneath with the gravity
Mm-hmm.
pulling you down. Now I can't remember, as far as you're concerned, did you climb up the pole or down, or were you hanging down from it?
No, I stayed on top of the pole the entire time.
Okay. Yeah. So that seems that's like the best way to do it. So then the one that I thought was really showed your strength and just your ability to compete and not give up was and I don't know the name of the actual competition, but when you were tossing barrels over with Shantae, I believe,
Yeah.
and initially, as soon as you start, your strength is evident because you put her on her butt, like, yeah, and then it kind of starts rolling. How did you feel about that particular competition?
Yeah, that game was called Resistance.
Hmm.
And when they walked us out there and showed us that, I was super excited because I felt like that one really played into my strengths. I have big legs, I'm strong, but I knew Shantae was going to be explosive. So she's a track girl. So like 3, 2, 1, go. I knew that if I wore her out, I could probably win that. And pretty incredible to go 5-0 on Resistance because now watching I didn't know what happened in the other races, and now watching, like, there were some races where people only got like one barrel over. So
Yeah, you
um
had all of them. Yeah.
but it was hard because you're constantly, I mean, there was no rest. I mean, it's just a constant like getting jerked backwards.
Hmm.
And I just remember thinking to myself, like, stay low to the ground, stay low to the ground. And I myself was kind of trying to use this jerking motion to keep her off balance.
Hmm.
And of course, getting to see the aerial view and getting to watch it on TV, I thought it was a pretty effective strategy.
Yeah, no, definitely. You dominated that particular game. There was a point towards the end where she kind of, again, obviously for obvious reasons, was exhausted. Like she couldn't really do anything. Did you just turn it up at that point, knowing that she was exhausted?
I couldn't really, I never looked behind me, so I never
Okay.
really knew what was going on. But I remember after I got the third barrel over, running for the fourth barrel, thinking that it was a little bit easier to get to it. But I think some of it is if the person is directly across from you, you're feeling a lot more tension versus if you're both on the same side of the arena, it felt like there was less tension.
Hmm.
So I guess I just assumed maybe she had run over to the same side as me, and it was just a golden opportunity to get that fourth one out. But the fifth one, although it looked like she was giving up, I mean, I was still
Hmm.
so exhausted, and those barrels are 50 pounds. I thought they would be
Wow.
easier to lift and just like chuck over the wall,
Hmm.
but it was like every amount of effort to get them over that wall.
What do you attribute that to? Was it awkward? Were they awkward to hold, or?
Yeah, no, they're awkward, especially when you're getting yanked backwards. They're just very large.
Hmm.
And they were not empty on the ends. They were solid on the ends. So
Hmm.
there really wasn't much to grip onto, so you're having to carry this large object and kind of push from the outside. And, most of the time I was also using one of my knees to really get the momentum to flip it
Hmm.
over the wall because the walls slanted backwards. So you really had to get some momentum to get them over if you didn't throw it.
Yeah, yeah. Did you see The Rock there? Did you pay attention to as he was walking around? Because he was making little gestures and things of that nature, or were you just so focused you didn't notice him?
I never saw him until the
Okay.
end of the competitions. I mean, you kind of like see him out of the corner of your eye when you're starting, but when you get out there as an athlete, you're totally focused. And a lot of times we didn't know how long we would be standing out there before the 3, 2, 1 go happened. Sometimes it seemed quick, and sometimes it seemed like you were standing there forever. And of course, watching the show back, Carrie Champion and Golden Boy and The Rock are doing their little one-liners, and it's kind of fun to hear the commentary and to watch it on TV because I couldn't even hear my family yelling, let alone The Rock. It was loud during the competitions.
Interesting. So, speaking of time, you were talking about how long it takes for the 3, 2, 1. How long did the actual competition take? Because I know there's obviously like they're cutting it to make it fit a certain frame. How long did that particular event take?
So the resistance was capped at 3 minutes, I believe. So
I see.
basically, you had to get 5 barrels out, or the person who got the most barrels out in 3 minutes. And so mine basically was capped when I threw that fifth barrel. But some of the competitions didn't have a time cap. For instance, I know everybody's favorite lunar eclipse. Some of those competitions went on for 20+ minutes, and you're only seeing 5, 6, 7, 8 minutes at most during those competitions. The kick out one, there were some brutally long battles on that, as well as
Mhm.
Herculean pull. So those battles where it's like you meet in the middle and it's one person against each other, those are literally won by the person who doesn't die out. I mean, it's like until somebody like falls off, it's like nobody can win. So those are literally really almost hard to watch in person
Mhm.
because you can just feel the pain of both those people,
R
versus some of the ones where it's just whoever runs to the end and pulls the golden chain first.
Right.
Some of those were super quick.
Yeah, I mean, if you've ever done any kind of like, and not you personally, obviously you have, but just people in general, if they've done any kind of endurance training or any kind of like just competition where endurance was a huge part of it, it gets to the point where like just even raising your arms becomes so difficult. Like every breath hurts, all the lactic acid in your muscles and everything like that. Like you said, it can be very like just grueling to watch somebody go through that for sure.
Yeah, on my like kick out
Uh-huh.
competition, for instance, I think there was a point where The Rock was like, I think her knee is hurt, and my knee was not hurt. My forearms were on fire. I mean, I just literally like couldn't even pull myself up anymore. And by the time I got to that middle one, I mean, it was like you're just like numb to the
Hmm.
pain.
Hmm. Yeah, I gotcha. So you go to Mount Olympus, didn't go, your way. How'd you feel about that? Obviously disappointed, but like, where did you think that you might have like lost some time? Like, what you could have done better? Those kind of things.
Yeah, Mount Olympus is hard. I mean, it's a grueling race, and Shantae is an amazing competitor. She's a track girl. Danny is top CrossFitter in the world. She's super
Hmm.
strong and agile. Um, it's hard to say. I mean, I feel like the iron ascent is what got me both times, and had I been able to have a little bit more upper body strength and get to the top of the mountain, I think the rest of it. I mean, pulling the heavy ball, those things are totally my strengths, but they were at
Hmm.
the end of the race. So, it's just, it is what it is.
Yeah.
And I'm super happy with a top 6 finish. And when you were asking about filming, I was there all the way till the end, till the finale. So it's
Hmm.
interesting how they show it by regions, but I'm super happy with how things came out.
Yeah, I mean, you definitely have nothing to, be ashamed of. That was an incredible performance just throughout your time there. I definitely saw that, like, when you got to the ball, you were still, I mean, it seemed like you were still fresh. It seemed like you were able to pull that ball with no problem. It's just like you said, those earlier ones kind of ended up, messing up with your time a little bit, and I think
Yeah.
that's kind of like what where you lost. But I mean, you were incredible throughout the whole thing. So what at this point are you planning to do like any more shows such like this? Like what's in the future for you?
Yeah, I don't know. I really kind of caught a bug getting back into Titan Arena and competing because it's been 13 years since I've competed in anything.
Hmm.
My kids are finally getting a little bit older. I've got a little bit more freedom, but I don't know. I don't know what's next. Now COVID happened and everything is shut down, but I've got some opportunities, that have come up, and I'm not sure what's next. But I'm a full-time practicing physician. I'm not leaving my patients. In the meantime, I'm back to the surgical world and delivering babies. I just came off a call weekend. I delivered 3 babies yesterday,
Wow.
so I'm back to my normal busy life right
Yeah.
as of now.
Yeah, your normal life is more exciting than most people's like, you know, like extreme situations. Like you seem like you've got so much, going on and a lot to be, happy about. So I greatly appreciate you coming on the show, taking the time. I know you're very, very busy.
I appreciate the
Yeah,
opportunity.
no problem. Hey guys, if you like the video, please subscribe and like at the bottom. And again, Jamie, thank you so much. We'll tag everything as far as your social media and anything else that you want us to tag at the bottom. We'll do that. And again, thank you for your time and have a great day.
Appreciate it. Have a good day.
Bye.